Ganesh here. Yes, please.
Okay.
Talking on Sri Ganesh's tried step-by-step of iStent implantation.
Good evening, everyone. Thank you for the opportunity to be here and present the talk on behalf of Dr. Sri Ganesh. This is about the iStent inject, and it's a step-by-step approach to this device and this technique. So first of all, patient selection. Which are the best types of patients to select to undergo this procedure? We always choose mild to moderate POAG patients. Pseudo-exfoliative glaucoma and pigmentary glaucoma are also okay to use with this device. CDR less than 0.8 because you want a good visual potential. Pre-op IOP up to 30 millimeters of mercury with medications is okay. And target post-op IOP is generally kept to around 15 millimeters of mercury. Phakic patients or pseudo-phakic patients with PCIOLs are okay. But here, in our center, whatever patients that we have been done with eyes needing cataract surgery. Patients with other side effects, complications, and other medications are excluded. Patients with poor compliance to taking medication are usually counseled for this device. Patients who would benefit from a reduction in IOP, normal angle anatomy by gonioscopy, and absence of peripheral anterior synechiae, rubeosis, or any other angle abnormalities is important. Now, just coming to the device itself, the design features, it has a head, thorax, and a flange. The head actually resides in the Schlemm's canal. The thorax resides in the trabecular meshwork, and the flange resides in the antechamber. This is the injector design. It has two buttons. It has a sleeve retraction button, which is the blue button that you're seeing here, and the black button is the iStent delivery button. So there's a sleeve which is protecting the trocar, which you need to pull back before injecting the device. Now let's come to this video of how to implant it step by step. Okay, this is routine cataract surgery. So after the implantation of the IOL, we use a sodium hyaluronate of 1.8% sodium hyaluronate. This helps in maintaining the antechamber, and especially in high myopes, it's to avoid the corneal folds and keep the AC nice and maintained while using the device. The next step is to turn the microscope by 30 degrees. You can see that there's markings that are made, which are pre-made, and the microscope can easily be tilted to 30 degrees towards the surgeon, and the head of the patient needs to be tilted away from the surgeon. This is the iStent inject. This is how it comes. We open it from its packaging and remove the protective sleeve there. Under the microscope, you'll see that it has a hollow metal tube, which is the sleeve, which protects the trocar. And these are the two buttons. The green button here is to slide back the sleeve, and the black button is to inject. There are two devices, the iStent inject, there are two devices which are loaded in each injector to be implanted about 3 clock hours away from each other. The plastic sleeve is removed. The patient is asked to look away from the surgeon. Most cases, all our cases are done under topical. This is the eye prism. It's a direct gonioscope, intraop gonioscope. So it's important to use the right amount of pressure to much pressure and there will be egress of viscoelastic and you lose the visualization. Here you can see there are already some folds that are developing on the cornea. This patient was a high myope, and in high myopes this happens where it's more compliant, and unless you inject visco and make the AC tight, there are folds which prevent proper visualization. So more visco is injected, and then you go in with the device, retract and click the button. You just need to indent the trocar slightly on the Schlemm's canal, which is identified by blood in the canal. This is the first important sign to note, a mild ooze after implantation of the device. This is implantation of the second device, and you see ooze again. So that is the first sign of successful implantation, when there is a mild ooze from the Schlemm's canal after implantation. Now, after implanting, it's important to visualize both of the stents and make sure that they're in the correct position. The second sign of successful implantation is, please note the conjunctival blood vessels there in the area of the iStent implantation. You can note that on overpressurization, it blanches. Can you see that obvious blanching which happens? This blanching is the second sign of successful implantation of the iStent device. So these signs have been described, and Dr. Ganesh has described this as a triad of signs, the third of which we will see. The eye is clearly overpressurized now. So we reduce the intraocular pressure, and you see it comes back down. The conjunctival vessels are not blanched right now. But once we go in and overhydrate again, that mild ooze causes a little hazy antechamber because of the blood there, but it easily goes away. So here you can see on pressurizing the side port again, just note the blood vessels on top in this area. Once the AC is cleared and that mild ooze is completely cleared, the AC is again overpressurized, and you see the blanching. Yeah, so see on the side port, on overpressurizing the side port, you see this blanching that happens in this area. The third sign is using intraoperative OCT. Here we see, so starting from the area of the iStent implantation and the area of outflow, you can see the anatomy of the conjunctiva here. It is boggy and it has fluid underneath. This sign is described as the fluid lake sign on intraop OCT. And the same OCT, when it's moved away from the area of the iStent implantation, you see the conjunctiva is very flat. Bringing it back to the area of iStent implantation, you see that there is quite a boggy conjunctiva, wavy conjunctiva with fluid underneath it. So all of these three signs together have to be noted after the iStent implantation. And in the absence of an intraop OCT, at least the first two signs indicate successful implantation of the device. Now coming to some pearls, it's important to constrict the pupil after cataract surgery with pilocarpine. Use a visco-adaptive viscoelastic to maintain the antechamber. Withdraw the sleeve of the injector after entering the AC, not before, because the trocar is quite sharp, it's quite sensitive. And on withdrawing after inserting it into the AC is the safest method. We need to identify the trabecular meshwork with blood in the Schlemm's canal. Place the trocar and indent very slightly. Press and hold the black button on the inject. Without releasing the button, you need to withdraw the injector and then release it. It's very difficult to, you may get a snagging of the device if you release it when the trocar is inside. The ooze of blood after injection indicates the successful implantation. Repeat the steps for the second iStent, 2 to 3 clock hours away from the first one, and pressurizing the eye will show a blanching sign. So these are the three, this is the triad of signs to be observed: mild ooze, the blanching sign, and the fluid lake sign. Now this is the same video of all the three signs. I'm going to skip ahead. and just come to some data. We've done about 30 implants in our center, and this is the first 16 patients in which you can see the drop in IOP. Preoperatively, it was around 16.88 average mean IOP, and at post-op 6 months, it's dropped to around 14.13 mean IOP. And here, very interestingly, we can see that the 2 patients in which only 1 out of the 3 signs of the triad were noticed did not have a significant drop in IOP even after iStent implantation, and these are the only 2 patients in which we required to continue them on anti-glaucoma medication. So 14 out of 16 patients were weaned off the AGMs, and 2 out of the 16 patients in whom we did not see all 3 signs had to be continued with the AGMs. So this is what this slide shows. And to summarize, there were no intraoperative post-op complications. And this indicates that the triad of signs is a reasonable marker for accurate placement of iStent. And of course, a larger sample size with longer follow-up period is essential to confirm these findings. Thank you very much for your patient listening.
Okay, let's go ahead and invite